a larger number of people will not attend hospital and will have fatalities at home. And we don't know yet the true toll, but I can tell you that cancer services across the country are seeing far lower rates of referral, are able to deal with those referrals far slower. There were fewer procedures happening, and the incidence, the rate of those diseases will not have changed in the population. So, yeah, in addition to the toll taken by the coronavirus, there will be a far wider toll taken by the fact that, as we have said, in my opinion, the hospitals have been overwhelmed because they've been unable to cope with this. And again, that IPPR report essentially said it would have been far better, instead of spending that money, several billion on, well, they spent 3.2 billion on PPE. It's come out this week as well. It's a huge figure, very inefficiently spent, and still were unable to provide PPE because it wasn't brought at the right time and in a timely manner, and the wrong PPE brought. But equally, the policy to open up all the Nightingale hospitals, which we know were underused, was the wrong kind of spending at the wrong time, in the wrong place. There's been dramatic cuts in social care, so our ability to care for people in the community. There have been dramatic cuts in capacity, and really what was needed were centres where we could take people who had the virus and care for them in a situation where they were isolated from the community and isolated from the most vulnerable in our hospitals and elsewhere. And that's been obvious to us all the way through, George, but that's becoming increasingly the spoken of narrative, but in a way which is put across in a way that absolves any responsibility. This was just a kind of natural event that couldn't be avoided. And I disagree with that as well, because as we know, and as we've said before, Operation Cygnus was presided over by Jeremy Hunt, by essentially this Conservative government, certainly a lot of their colleagues. And in that context, they quite clearly saw that all their policies would lead to our inability to cope with the pandemic. Now, clearly they didn't know a pandemic was 2 years away, but pandemics are actually regular occurrences and a part of our planning. Should be a part of our planning, but they made the decision to bury that policy, to bury that report, not to make adequate preparations for this pandemic, quite deliberately, because it interfered with their general policy, which is one of privatisation of the National Health Service.